Cannabis and your body. Benefits, effects, and risks. Introduction. Hook. What if one plant could help reduce pain for some people, while at the same time increasing anxiety, affecting memory, and even impacting brain function in others? Cannabis is one of the most talked about substances in the world today. Some people consider it a natural remedy. Others see it as a serious health risk. But what does science actually say? Can cannabis really help with certain medical conditions? What happens inside your brain and body when you use it? And are the potential risks greater than many people realize? In today's video, we're diving deep into the science of cannabis. We'll explore its potential benefits, its effects on the brain and body, common myths, hidden risks, and what every person should know before using it. Make sure you stay until the end, because one of the biggest misconceptions about cannabis might completely change the way you think about it. Let's begin. What is cannabis? Cannabis is a plant that contains hundreds of chemical compounds called cannabinoids. The two most well-known cannabinoids are THC and CBD. THC, or tetrahydrocannabinol, is the compound responsible for the high associated with cannabis use. CBD, or cannabidiol, does not produce a high and has gained attention for its potential therapeutic effects. When cannabis enters the body, these compounds interact with a complex network known as the endocannabinoid system. This system helps regulate important functions including mood, memory, sleep, appetite, pain perception, immune response. Think of the endocannabinoid system as a communication network helping different parts of your body stay balanced. When cannabinoids enter the system, they can influence how this network functions. But here's the important question. Does that influence always help? Not necessarily. And that's where things become more complicated. What happens when you use cannabis? Imagine someone using cannabis for the first time. Within minutes, they may experience relaxation, euphoria, altered perception of time, increased appetite, changes in sensory experiences. Colors may appear brighter. Music may sound more intense. Food may taste better. Many people describe these effects as pleasant, but others experience something very different. Some users may develop anxiety, panic, confusion, dizziness, impaired coordination. Why such different reactions? The answer depends on several factors. The amount used, THC concentration, individual brain chemistry, age, frequency of use, overall health. This means the same product can affect two people very differently. Have you ever noticed how some people seem completely relaxed while others become uncomfortable after using the same substance? Cannabis is one example of how individual biology can dramatically influence outcomes. The potential medical benefits of cannabis. Now let's discuss why cannabis has attracted so much medical interest. Researchers have investigated cannabis and cannabinoid-based medicines for several health conditions. 1. Pain management. Chronic pain affects millions of people worldwide. Some studies suggest certain cannabis-based products may help manage specific types of chronic pain. This is one reason why medical cannabis programs exist in some regions. However, cannabis is not a cure, and results vary significantly between individuals. 2. Nausea and vomiting. Cannabinoid-based medications have been used to help some patients experiencing severe nausea, especially during certain medical treatments. This has been one of the more established medical applications of cannabinoid therapies. 3. Certain seizure disorders. Some CBD-based medications have been approved for specific seizure disorders. For certain patients, these treatments have significantly reduced seizure frequency. This demonstrates an important point. Not all cannabis-related products are the same. Medical use often involves carefully controlled formulations under professional supervision. 4. Sleep problems. Some people report improved sleep after cannabis use. However, the relationship between cannabis and sleep is more complex than many people realize. While it may help some individuals fall asleep, long-term use may affect normal sleep architecture and sleep quality. We'll discuss this in more detail later. The effects on your brain. Now let's move to one of the most fascinating and important topics. What happens inside your brain? The brain contains many cannabinoid receptors. When THC activates these receptors, it can influence several mental functions. Memory. One of the most recognized effects of cannabis involves short-term memory. People may have difficulty remembering recent information while under the influence. For example, You walk into a room and forget why you entered. You start a conversation and lose your train of thought. You misplace everyday items more often. These effects are usually temporary, but frequent heavy use may create longer-term concerns for some individuals. Attention and concentration. Cannabis can affect focus and decision-making. Tasks requiring quick reactions or sustained concentration may become more difficult. This is particularly important when driving or operating machinery. Even when someone feels capable, reaction times may be slower than normal. Mood. Some users report feelings of calmness and relaxation. Others experience increased anxiety or paranoia. Why? Because the brain's response can vary greatly depending on the individual and the circumstances. Stress levels, environment, dosage, and mental health history all play important roles. Motivation and productivity. A common debate surrounds cannabis and motivation. Some people claim cannabis enhances creativity. Others feel less motivated and less productive after using it. Research suggests heavy use may affect goal-directed behavior in some individuals, although experiences differ widely. The key takeaway? Cannabis affects more than just mood. It influences memory, attention, judgment, and behavior. And understanding those effects is essential for making informed decisions. Cannabis and mental health. This is where the conversation becomes especially important. Mental health and cannabis have a complicated relationship. Some individuals report temporary stress relief. However, cannabis is not a substitute for professional mental health treatment. In some people, especially those who may already be vulnerable, cannabis use can worsen symptoms of anxiety or contribute to psychological distress. Risk factors may include family history of certain mental health conditions, early age of use, frequent use, high THC products. Think of cannabis like a tool. The outcome depends on who is using it, how it is used, and the circumstances surrounding its use. What helps one person may create problems for another. And that's why understanding risks is just as important as understanding benefits. Myth versus fact. Let's bust some common myths. Myth 1. Cannabis is completely harmless. Fact. Natural does not automatically mean harmless. Many natural substances can still have side effects and risks. Myth 2. Everyone reacts the same way. Fact. Responses vary dramatically between individuals. Age, genetics, health status, dosage, and frequency all matter. Myth 3. More cannabis means better results. Fact. Higher doses may increase the likelihood of unwanted effects such as dizziness, anxiety, and impaired judgment. Sometimes more is not better. Sometimes more simply means more side effects. So if these myths aren't true, what are the biggest health risks people should understand? The physical effects of cannabis on your body. We've talked about the brain, but cannabis doesn't only affect the mind. It can influence multiple systems throughout the body. Cannabis and the lungs. One of the most common ways people use cannabis is through smoking. When smoke enters the lungs, it can irritate the airways and respiratory system. Some users may experience chronic coughing, increased mucus production, throat irritation, wheezing. Think about how your lungs are designed. Their primary job is to bring oxygen into the body efficiently. Anything that repeatedly irritates the airways can make that job more difficult. This doesn't mean every user will develop serious lung problems, but regular exposure to smoke can place additional stress on the respiratory system. Cannabis and the heart. Many people are surprised to learn that cannabis can also affect the cardiovascular system. Shortly after use, heart rate may increase. For healthy individuals, this effect is often temporary. However, for people who already have certain heart conditions, these changes may deserve extra attention and discussion with a healthcare professional. This is why understanding your overall health status is important before using any substance that affects the body's normal functions. Cannabis and appetite. Have you ever heard someone talk about getting the munchies? Cannabis can increase appetite in some individuals. For people struggling with appetite loss due to certain medical conditions, this effect may sometimes be beneficial. However, for others, increased appetite may lead to excessive calorie intake and unwanted weight gain over time. Again, the effects depend heavily on the individual and the situation. Cannabis, sleep, and recovery. Many people use cannabis because they believe it helps them sleep. And in some cases, it may help individuals fall asleep faster. But here's where things become interesting. Falling asleep and getting quality sleep are not always the same thing. Healthy sleep consists of multiple stages that help the brain recover, process memories, and regulate emotions. Some research suggests long-term cannabis use may alter normal sleep patterns. As a result, a person might feel like they're sleeping enough hours while still not achieving optimal sleep quality. Ask yourself this: would you rather spend 8 hours in bed or wake up feeling truly refreshed and energized? Quality matters just as much as quantity. Can cannabis lead to dependence? One of the biggest myths is that cannabis can never be habit-forming. The reality is more nuanced. While cannabis does not affect everyone in the same way, some individuals can develop problematic patterns of use. Signs may include difficulty cutting back, using more than intended, spending excessive time thinking about or obtaining cannabis, continuing use despite negative consequences, feeling uncomfortable when trying to stop. Dependence does not happen to everyone. However, understanding that it is possible helps people make more informed decisions. Imagine someone who initially uses cannabis occasionally to relax. Months later, they feel unable to enjoy normal activities without it. What started as occasional use may gradually become a habit that feels difficult to control. This is why awareness is so important. Who may be at greater risk? Not everyone faces the same level of risk. Certain factors may increase vulnerability. Early age of use. The brain continues developing through adolescence and into early adulthood. Because of this ongoing development, younger individuals may be more sensitive to some effects of cannabis. Frequent use. The more often cannabis is used, the greater the potential for unwanted effects and complications. High THC products. Modern cannabis products can contain significantly higher THC concentrations than products from previous decades. Higher potency may increase the likelihood of negative effects in some individuals. Personal and family health history. Mental health history, cardiovascular conditions, and other medical factors can influence how cannabis affects an individual. This highlights an important lesson. Health decisions should never be based solely on someone else's experience. What works for one person may not be appropriate for another. Real-life example. Let's consider two fictional examples. Sarah uses a medically prescribed cannabinoid treatment under professional supervision for a specific health condition. Her dosage is monitored carefully, and her healthcare team regularly evaluates her progress. Now consider Jake. Jake receives advice from friends, uses high-potency products frequently, and never discusses his use with a healthcare professional. Even though both individuals are using cannabis-related products, their situations are completely different. This demonstrates why context matters. The conversation isn't simply good or bad. The more important question is, how is it being used, why is it being used, and what risks are involved? How to reduce potential risks. Whether someone uses cannabis or is simply interested in understanding it, several strategies may help reduce risk. Stay informed. Reliable information is one of the most powerful health tools available. Avoid relying solely on social media trends or personal anecdotes. Look for evidence-based information. Avoid driving while impaired. Reaction time, attention, and judgment may be affected. Driving under the influence can place both the driver and others at risk. Know your health history. Understanding your personal and family medical history can help you make safer decisions. Pay attention to mental health. If cannabis use appears to worsen anxiety, mood changes, or emotional well-being, it is important to seek professional guidance. Prioritize healthy habits. No substance can replace the foundations of good health. These include regular exercise, nutritious food, quality sleep, stress management, strong social connections. The healthiest lifestyle is built on consistent habits, not shortcuts. Myths people still believe. Before we finish, let's address a few more common myths. Myth: if it's legal, it's completely safe. Fact: legality and safety are not the same thing. Many legal substances can still carry risks. Myth: cannabis improves everyone's mental health. Fact: some individuals may experience temporary relaxation, while others may experience increased anxiety or discomfort. Myth: you can't overdo it. Fact: using large amounts can increase the chances of unpleasant and potentially risky effects. Understanding limits and individual responses is essential. The bigger picture. When discussing cannabis, people often take extreme positions. Some claim it's completely harmless. Others claim it's entirely dangerous. The truth usually lies somewhere in between. Cannabis contains compounds that have shown potential medical value in certain situations. At the same time, it can produce unwanted effects and risks, especially when used irresponsibly or without understanding individual vulnerabilities. The goal isn't fear. The goal isn't blind acceptance. The goal is knowledge, because informed decisions are almost always better than uninformed ones. Conclusion. So what should you remember from today's video? Cannabis affects the brain, body, mood, memory, sleep, and overall health in complex ways. Some individuals may experience potential benefits under specific circumstances. Others may experience unwanted side effects or health risks. The impact depends on factors such as age, dosage, frequency of use, overall health, and individual biology. That's why there is no one-size-fits-all answer. The most important step is staying informed, understanding the science, and making thoughtful decisions based on evidence rather than myths. Your health is one of your most valuable assets. Protect it, educate yourself, and never stop learning about the choices that affect your body and mind. If you found this video helpful, don't forget to like, comment, and share it with someone who might benefit from this information. And if you enjoy evidence-based health content that helps you make smarter decisions, be sure to subscribe and turn on notifications so you never miss a future video. Thanks for watching, and I'll see you in the next one.